Hi, this is your last module. It's Module 9, Rehab and Restorative tutorial. Again, this is your WWCC Nursing Assistant course, NRST 1510. So let's move on to and do your quick reminders for this one. Yay! Again, you are done after this with your module portion of the class. You still have to complete your lab and clinical and also your final, which will be in your lab portion. Again, great job. Thank you for working so hard and so quickly. I know this course is demanding at times, and hopefully it hasn't been too hard on you to get them done. The great part is that it is online and you can do it at the comfort of your home late at night when your kids are sleeping or maybe after work. So hopefully you've enjoyed it as much as I've enjoyed teaching it. The sub-modules for this module are rehabilitation and restorative care, activities of daily living, ambulation, assistive devices in ambulation, range of motion, cold and heat packs, and compression garments and breathing exercises, and then you have a communication exercise. The rehab and restorative sub-module is going to go over physical rehabilitation, that these programs are there to help the patient get back to the highest level of function. So remember, when you go in, sometimes you might think that they need to be here, but we want to get them to their highest level, so it might not be as high as you think. So they're working to get them on the highest level of function that they can. Restorative care is a program that nurses and CNAs do run with help sometimes from physical and occupational therapists. We try to get input. Again, healthcare workers, we all work as a team, and we meet and try to make the patient or the client have the best possible care as possible. So restorative is focusing on the mental, emotional, social well-being of that patient. If you decide to work in this kind of program, you're making sure that the patient gets to make choices, that you're providing privacy, you're avoiding distractions, you're encouraging them to have independence, you're being sensitive to their needs, and maybe they're just not being able to perform where you think so, and be sensitive towards that. You're being supportive and you're being patient. Sometimes our body just doesn't work like we think it should, so go into it being patient, and make sure you're using the correct body mechanics also. And that they are, because that's going to create more injury if you're not using the correct body mechanics. And if you do notice any pain on the patient or your client, make sure you're stopping as soon as you recognize that. The next module is activities of daily living, also abbreviated many times of ADLs. Okay, you'll see that tons of times. ADL, that just means the stuff that you do on a daily basis. So your personal hygiene, your dressing, your toileting, eating. What else do you do on a daily basis? Anything like that. So right here. Okay. You're helping the client with those ADLs using assistive devices if needed. So if they are eating and they need a thicker, maybe a thick spoon or baby spoon, or maybe a spoon that wraps around their arm to help them be able to feed themselves better, that you're using that. Okay. Also, that you're training them how to use those assistive devices, and you're training them how to get ready for the day without you having to do it for them. So maybe everybody's different, so you might have set up one person and the other person might need verbal cues. Maybe the other person needs you to demonstrate for them. And the last way we help train them is hand over hand. That is helping them guide their hand to it. So maybe you're helping them eat, you're guiding their hand to their mouth. Okay? When you're helping them in this with their ADLs, you need to set up, I think that's what it's not supposed to be seat, it's set up the patient with their belongings. Maybe you need to give clear, brief instructions. You might need to organize them, allow them to struggle a little bit, and teach them safety. Okay. Also, make sure you're arranging items in order of use. Okay. If you want them to get dressed and then brush their hair and then brush their teeth, you'll put their clothes, then their hairbrush, and then their toothbrush. Okay. So set it out in the order that they need. Okay. The other part of your restorative program is bowel and bladder training. When we're training the bladder back to working like we think it should be working, and remember, we're getting it to level as they need. Sometimes it's not as high as we want. You might be prompting them to go to the restroom every 2 hours. You're going to do habit training, so reminding them right after meals to go to the restroom. Another way is to do the Kegel exercises, or teach them how to do that. That should strengthen up those muscles so they don't remain incontinent. If you're doing bowel retraining, then again, we're going to use habit training again. Increase their fiber and fluids. Usually the dietary takes care of the fiber part. However, fluids, super important. I'm going to draw a little star over there. Because every time you go into the room, remember, you're the one dealing with a lot of their care. So if you're going in the room, even to turn off the call light, hand them their water that's next to their bed. Any amount of fluids that you can give them. You also might want to walk them down to the meal. That is excellent in helping their bowels start moving properly. And also teach them stress management. So ambulation is the next one. Ambulation is just the process of moving about. So maybe you're ambulating without assistance. Maybe you need assistance. It's walking, transferring to and from a chair to a wheelchair, or even things like that. So how we get the process of moving about. There is different levels of ambulating a patient. They could be independent, they could be set up, supervised, limited, and extensive. Again, independent, that means that you can tell them to go and they'll go. Setup is you might need to put their walker next to their bed or their wheelchair next to their bed. Supervised limited, that is a times one assist, which means one person needs to assist them at all times. And extensive is a two-person assist, or maybe a lift of some sort. In any type of transfer, you should always put a gait belt on your patient. This not only helps you with your body mechanics and your safety, but it helps them with their safety and provides them with better support and balance, and it gives them that sense of security when you're walking them. Just want to point out, if you do happen to have a patient fall on you, that is needed to be reported to the nurse immediately. Do not pick up that patient, leave that patient when you found them. I've had a couple of patients say, oh, don't tell them, it's okay, just leave me alone, I always do this. Then you need to report that still. And don't scream down the hall, hurry up, get a nurse, Miss Mary fell, hurry. It's my example is it's like screaming fire in a movie theater. It's just not done, because first you're invading their HIPAA privacy, and it scares a lot of the other residents, plus staff members and family that might be visiting. So all you need to do is maybe ask the housekeeping or another staff member, another CNA, go get the nurse, ask her to come to room. My example is 205 as soon as possible. Assistive devices for ambulation. These are just some examples of what you can use for ambulation. There's a cane. Of course, there's a single tip and a four-prong tip. Sometimes they call it a quad cane. There's walkers, different types there. You might see a four-wheeled walker, a standard walker, or a platform walker. And also another is crutches, which is there's a lot of different crutches, and you'll go over these in Healthcenter 21. The next submodule is range of motion. There's full range of motion, which is just normal direction and distance through which joints move. Okay, so I am doing full range of motion right now. Okay, limited, it means there's a reduction in the movement in some way. So there's different levels to that. There's active range of motion, active assistive range of motion. Let me auto-correct that real quick. And passive range of motion, and resistive range of motion. Active range of motion, the patients can do everything without being helped, just prompting, usually say, can you move your arm up and down? Active assistive range of motion means the patients can move the joint, but you're helping them, maybe supporting their arm like this and bringing it up. Okay. Passive range of motion means that the patient cannot move the joint at all, that you are moving it through the whole range of motion. So if my arm was limp, my arm would still be supporting. My arm's still supporting their arm's limper, so I'd be doing all of that lifting for them. Okay, it's kind of flaccid. Resistive range of motion means the healthcare providers providing resistance, so the patient, when they're doing that range of motion, they're pushing against it. So it's like their hand would be here, and they're asking you to push it down, and they're building it. Okay, maybe they have weights of some sort. Also in this module, there's a lot of terms that they go over. Just a reminder for you to learn those terms. Make sure you make some flashcards, write it down, take notes, whatever you do, so you can memorize those terms. The next submodule is your heat and cold applications. Just remember, cold decreases bleeding, reduces swelling, and relieves pain. The heat promotes healing, relieves pain, and can help with stiffness. Also, it will go over the different types of heat and cold in your Healthcenter 21 unit. And one I like to point out is the sit staff. You will see these more commonly if you work in the OB unit at the hospital or some kind of GYN office. It's a moist heat, but it's in a mini tub that fits inside the toilet, and then there's a sprayer that is in that built in and hooks up to the sink, and then it sprays warm water to the peri area. Okay. The next submodule is your compressive garments and breathing exercise module. It's going to go over your binders, which is abdominal, chest, and peri area binders. Remember, a binder just increases the circulation, reduces swelling, can support the muscles. They're also going to go over deep breathing and coughing exercises, which is great because it expands the lungs and helps remove mucus. They're also going to go over elastic stockings, which other names are TED hose, anti-embolic hose, something in that nature. We'll actually go through this skill in lab. So please make sure you're taking notes to this one and knowing how to put on your stockings. They are compression stockings, but they're applied to the legs. Some go up to the knee, and some go up to the calf. Some go up to the calf. Some go up to the knee. Some go up all the way to the thigh. So depending on what the need of that patient is the type we'll get. They do have to be measured for these elastic stockings, and I'll show you how to do that in lab. They are usually used after surgery to prevent blood clots, or maybe they're in the hospital for a long period of time. Also commonly used for edema to their lower extremities. That's where your legs swell. And then after that submodule, you'll have a communication exercise. So make sure you understand the communications exercises are just for your use. You aren't scored on those. So that is pretty much sums it up, your Module 9. If you have any questions at all, please make sure you contact your instructor as soon as possible. Just a reminder to make sure that your grade is above 75%. And if you have any questions regarding your vaccinations, clinical lab, what to wear, making sure that you're emailing your instructor or contacting me as a coordinator, and I can try and help you. So again, have a great day. Enjoy your last module.